we can move on to the fungal infections of the skin. Till now we have studied regarding the bacterial infections of the skin. Now we move on to the fungal infections of the skin. So in that, first one, Pityriasis versicolor or Tinea versicolor. Pityriasis versicolor, in Malayalam we will say Shunang. Okay. So we can move on to that. As an introduction, we can say it is a common long-term fungal infection of the skin. Especially it is the superficial infection of the skin. And Pityriasis versicolor, otherwise known as the Tinea versicolor, or other names are there: dermatomycosis furfurae or Tinea flava. Okay, you just understand it. Then it is characterized by well demarcated scaling patches with a variable pigmentation occurring most commonly on the trunk. Okay, if you have the history, or you may have seen this Pityriasis versicolor or Tinea versicolor in your life. Okay, most of the persons may have, or during their childhood may get this fungal infection. Anyway, it is a well demarcated scaling. Here, when we are observing the versicolor, we can see a well demarcated scaling, and the pigmentation may be hypopigmentation or the hyperpigmentation. And most of the time we can see it is in the trunk or in the back of the neck. Okay. And the causative agent of Tinea versicolor is the Malassezia furfur. Okay, you just understand it is a yeast infection. Okay, if you have the difficulty to study the name of the yeast, no need to study. Just understand it is a yeast infection. Okay, and it manifests clinically as white or light brown macules that may be discrete or confluent on the trunk specially. So here I already explained that there will be hypolesions, hyperpigmented lesions and hyperpigmented lesions. Okay, it may occur as a patches or it may occur as a macules. Usually it is appear as a macules. Hyperpigmentation is the, according to the nature of the skin, there may be hypo or hyperpigmentation. And most of the persons will be asymptomatic, and most of them, they will not care about these changes. Okay, when they got itching, they will go to see a doctor. Some persons they may cause itching. Then chest and back are the usual location of the this fungal infections. Okay. I already explained the feature of or clinical manifestation of this Tinea versicolor. That is, there will be multiple macules or patches varying in appearance, and the lesions may be hyperpigmented, hyperpigmented, and some patient may have the erythematous lesions. Erythematous lesions means red lesions, red color lesions. Commonly affected areas: back, chest, abdomen, neck, upper limbs. The common site is trunk and back. Okay. The children often acquire facial macular lesions. Children have the appearance in the face too. The causative factors for Tinea versicolor. The causative factor for Tinea versicolor is weak immune system, hormonal imbalance, excessive oily skin, living in hot and humid weather, excessive sweating, genetic history of Tinea versicolor. So weak immune system, we knew that if the patient have the weak immune system, they will harbor the microorganism very fast. Okay, they may got infections very easily because of this weaker immune system. Then hormonal imbalance. If the patient have the hormonal imbalance, they are the risk of infections. Then excessive oily skin. Excessive oily skin, because of the oily nature, the microorganism, they may adhere to the area, and when there is an entry to the skin, they will multiply there. Okay. Then living in hot and humid weather, we can say the climate change that may cause disease. Okay, so that's it. Then excessive. So excessive, next one, excessive sweating. So the excessive sweating that increase the moist in that area, that will harbor the microorganism and they multiply in that space, especially the groin, axillae. There may be increased chance of itching, then infections, etc. Okay, so moisture that increase the chance of infection. Then genetic history of tinea versicolor means if the parents have the history of tinea versicolor, their offsprings also are in risk for the tinea versicolor. Okay, so it may transfer from parents to the children or offsprings. Okay, so that's about the causes of tinea versicolor. In this picture, you can see the hypopigmented lesions in the back of the neck. Okay, so I already explained, based on the skin nature, there may be chance for the hypopigmented lesions and the hyperpigmented lesions. Here, in the third picture, you can see the brownish appearance of the skin. Okay, so that is the hyperpigmented lesions. So hyperpigmented, sharply marginated brown scaling macules. Okay, in the left side of the neck. So I already explained there will be hyperpigmented and hyperpigmented lesions. So that is the example. Regarding the management, non-pharmacological therapy, that is the sunlight accelerates repigmentation of hyperpigmented areas. So when we are exposed to sunlight, the hyperpigmented areas become hyperpigmented. And usually we are giving topical medicines, topical applications for the management of tinea versicolor. So the drugs used are selenium sulfide 5% suspension, applied daily for 10 minutes for 7 consecutive days. So usually we are giving selenium sulfide drugs. Then antifungal topical agents also can be given, that is miconazole, clotrimazole 2%. Okay. Then if it is not effective, then we will give the oral treatment, that is ketoconazole 200 mg 4 times a day, or single dose, that is 400 mg. Okay. So there may be chance for the hepatotoxicity and side effects, GI side effects and heart failure risk for this patient, but it is not necessary. Okay, sometimes if the patient is allergic only it comes, and if we are excessively, if we use this medicine, then only the side effects will be occur. Otherwise for 5 days or for 1 week it will not be a problematic one. Okay, so here we are completing tinea versicolor. Okay.